Hello, thank you, Julie. My name is Dr. Debra Rose Wilson, and I am a health psychologist. And I'm here today to representing a couple other health psychologists who contributed but couldn't be here. Dr. Howren is a PhD and an MPH, Master's in Public Health, and Dr. Ethel Perry, all three of us teach in the health psychology program here at Walden. Next slide. A little bit about my background. I have an undergraduate degree in psychology. I have an undergraduate degree in nursing. I have a master's in nursing, a PhD in health psychology. I'm actually working on a graduate degree in physics right now. So that's kind of my background. I'm very eclectic, hence the name. Health psychologists are not licensed like clinical counseling or school psychology. We tend to work with groups instead of with individuals. Our role is often to help people manage or prevent illness or improve wellness. And we work usually at a community level, promote community health, find populations who need help with learning or understanding and make those changes. We integrate lifestyle factors. Instead of just a psychological or medical approach, we're adding the holistic aspects that are important to treatment. And we understand that a holistic approach is essential to working with anyone from any culture. And we also provide opportunities for other people to consider, physicians and psychologists and psychiatrists, to consider how physical, emotional, spiritual, environmental, all those other factors, how they influence our immune function. And if we're stressed and we're not socially supported, our immune function is impaired and we don't do as well when it comes to health. Next slide. So I'm here today to talk about opportunities for health psychologists, and more specifically what I've done and what Dr. Perry and Dr. Howren have done with our careers in health psychology. I graduated in 2006 with my PhD, so I've been around a little while and I'm old. But here's some of the things that we've worked on. You might want to consider working with a health department. For example, I was working with the public health department, and we get reports regularly from emergency, or what are the trends of people showing up in emergency. And at the beginning of one summer, we saw head injuries in children rise dramatically. And it's, of course, they're on their bikes, they're falling, they're not wearing bike helmets. And this was long enough ago that bike helmets weren't cool yet. So recognize this as a problem, recognize this as something that we could work with. I'm getting paid by the public health department. I write a grant to get some help with this. I approach a car dealership and they help sponsor this, and they provide helmets for all the kids who take a course. I approach a bike shop in town as well as the police department, and they're providing actual training for these kids. And then we provide these workshops. And they were a full day Saturday workshop. We did 4 of them one summer and reached a bunch of kids. The bike shop had bike giveaways each time. And that became a regular grant. That was a program that was started that continues to this day, even though I'm not involved in it anymore. And it's a reoccurring grant to address that population. All 3 of us work in academia, and we've all written grants for programs and working with health departments. And I'll give you an example of one I'm writing right now. I work at Austin Peay State University. That's my full-time job. I'm contributing faculty at Walden. And there is an issue with women in rural areas not getting to mammograms. They're difficult to get to, it's difficult to book. Sometimes they don't have insurance. So there was a mammogram bus that they had years ago, but it's not being used because they don't have the funding to get it. So I'm writing a program right now, a grant right now, to kick that program back up. The bus already exists. We need money for someone to run the program, for radiologists and radiologist assistants to be available to read the x-rays and the mammograms, follow up nurses for intake. And I'm running a grant for that. And I'm expecting it to be successful. It kind of fell away during COVID. That program fell away the last 3 years, so we're starting it back up again. And that's a program we've had going for about 6 years, but like I said, I have to rewrite a grant now. You might want to consider doing what we did and working in an acute or a long-term care facility. I've worked in both. For example, at a local cancer hospital, I was doing some consulting with them on something else, and they mentioned that they were really hoping to get some stress management education for women who are newly diagnosed with breast cancer. Well, I'm certified in stress management. It's a big part of what you learn as a health psychology, stress and how it influences your immune function and health, as well as how to manage stress. And I started with just for free. I did 4 classes for them once a week for 4 weeks to see how it went. And then I was offered a contract to do that 3 times a year and to get paid for it. So, you know, as you're emerging in your local area as a health psychologist, sometimes you do have to provide some free presentations, but they always seem to pay you back well. Chronic pain management. What we do as health psychologists is also work with pain patients and pain groups and help them discover and learn new ways to manage chronic pain, because we're in an opioid crisis and we just can't afford to keep that up. I'm also a clinical hypnotherapist, so I teach 2 groups, stress management, as well as managing, getting into a trance-like state, using that trance-like state to set aside pain, finding ways to manage pain. And you might want to consider working for community groups. I did a volunteer group for a little while at a sexual abuse center. I was approached by a nurse practitioner who said, who didn't want to do it anymore. And she did it a couple times a year. She went in and just did a workshop on how to get through a PAP test for adult survivors of childhood sexual abuse or rape victims, which is a very tender subject. They liked what I did, and they asked if I could do more for their clients. I wrote a grant and to pay my salary, as well as to pay for items for the people who are attending. And they got things like a candle or lotion or some self-care item, because we're teaching them about self-care, self-awareness, and stress management. And I did a series of 4 stress management over 4 weeks. I did that. I've been doing that now since probably about 2004, even before I graduated. And I still do it once or twice a year, though I do have a younger person taking over from me on that end. Church groups might invite you to come and talk about what antioxidants are and why they're important. And that's something we learn as a health psychologist. And I've been invited to church groups, and I don't mind presenting for free, because I had my card out and I always get 1 or 2 requests for more presentations. And for example, when I did just recently turned into 2 full-day workshops with a great big phone company here and all their administration. And it was quite a bit of money for them to pay me to do 2 full-day workshops for everyone. So that's, another option to consider. Next slide, please. I speak to a lot of groups. The Trigeminal Pain Association, that's a local support group here for people with trigeminal pain. If you don't know what that is, trigeminal nerve runs along here, along the jawline. And if it gets inflamed and you have pain in that area, it's also called the suicide pain. And I'm not planting any ideas in anyone's head. The way that cranial nerve works is it doesn't quite go through the pons, so the pain isn't filtered in any way, and it's excruciating pain. And they can't take the opioids. The amount of opioids that they would need over time would kill them. So they have to find other ways to deal with pain. And so we're doing things like self-hypnosis, guided imagery, and those sorts of things that I'm also trained in and certified in. Autoimmune groups, rheumatoid arthritis, for example, grief support groups. I'm on the board for Sharing of Middle Tennessee. They are a support group for families who've lost babies to miscarriage, stillbirth, and neonatal death. And I speak to them, I run their support groups, and we also have lay people helping run this group as well. And it just is an opportunity for me to get out there. And from that grief support, I've been brought in several times to with a contract to do more training on how grief affects your health and why it's so important to do that self-care when you're grieving so that you don't get sick. Kind of a strange one was a Western Aronia Berry Association. And Aronia berries are grown in the United States. And you may have heard the acai berry or blueberries, but these are really, really high in antioxidants and nobody knows about them. And they wanted me to come and speak to this group of farmers and explain to them what antioxidants were so that they had an ability to better market their program. Well, it ended up being quite a relationship with this association. I actually had one of my psychoneuroimmunology students with me who joined me at this, and she ended up writing for their newsletter and still does that, I believe. And it's just led to a lot of other connections throughout the country for this sort of education for the groups. And if you go in and speak, they're going to pay you a stipend. They're also going to pay your way. And it's just an opportunity to get your name out there. So take those, even if at first you don't get paid. Working with addiction counselors and dietitians, that's things that Dr. Perry and Dr. Howren have done, where they work with those groups to help them better understand how to reach a population, how to do population health, how to create brochures, how to create websites that have accurate medical information on it. You might want to consider, like I did, writing grants to develop smoking cessation programs. There's lots of grant money out there for that. We wrote a grant that we were doing a support group. It lasted about 3 weeks. Included in their smoking cessation program were some options. They could take a medication, Walbuterol, or they could take the patch. Those were available for them for free. And of course, whenever you're going to develop any program, you got to measure your outcomes so that you can get the grant again. And that's something in health psychology that we're taught, that you really have to be able to have measurable outcomes so that you can say this worked and can I have the money again. Maternal education program, something like Best Beginnings, which was a specific program to address low birth weight and poor pregnancy outcomes in the area. So we started a program identifying, with the public health department, identifying who's at high risk. And we hired nurses, dietitians, and they went into the homes of these pregnant women. Some of them were adolescents, some of them were street kids, some of them were immigrants or low socioeconomic, but they were at risk. And they provided prenatal education. They provided milk vouchers that they could get free milk at MAPCO. We gave them prenatal vitamins and then helped them get their prenatal care appropriately during their pregnancy. And of course, measured outcomes. Community kitchens is something else I've been involved with, an area where low socioeconomic, maybe immigrant, maybe not, but an area of downtown in a big city. People can come together in a community kitchen, and if you can write a grant and get a dietitian and a few other educators like nurses to help you out, you bring these people in, you teach them about nutrition, you teach them how to shop, they all make dishes together, and when they go home that night, they have meals for their family for 3 or 4 days. Or a lot of grants right now are available for rural areas focus, as well as areas for the poor and the underserved. Those grants are available, whatever health need that they may have, a grant can be written. You can write your salary into the grant and work with those populations. Sometimes, and I know Dr. Perry and Dr. Howren do this a lot more than I do, you conduct program evaluations as a contractor, where they want to get their money again from a grant the following year, but they didn't analyze their program and look for outcomes. So we go in and help them find outcomes that they can measure from their program. Next slide, please. Something else that I do, I review brochures and websites for accuracy. I work for Healthline, also Medical News Today, and that's an association of about 5 different websites that have, WebMD is another one, that have information for the public about health issues. My expertise are things like complementary alternative therapies, women's health, breastfeeding, I'm a lactation consultant, and stress and stress management. And all their websites that have to do with these concepts, I review for them for a fee. I already mentioned program evaluations. You might also be brought in to help to make sure that websites or brochures that are put out by drug companies or rehab clinics are not only medically accurate, but appropriate for the population. Is, if this is for 12-year-olds about how to give your own insulin, then it has to be for a 12-year-old audience, and helping them set their website or their brochures for the audience intended. A lot of what I've done in the past, and both Dr. Perry and Dr. Howren did as well, is we do bag lunches at clinics, at conferences, so that they know what services are available in this community, what a health psychologist does. And it might be to social workers or counselors or any group, but those almost always provide opportunities to present or do more work in the future. And of course, all three of us also teach. Next slide, please. Rehabilitation hospitals, I believe this is Dr. Howard who is developing programs to keep staff and patients healthy. We're getting a little into IO, but because this is a healthcare system or a hospital, their needs are a little different than just IO psychology. And sometimes there's an IO there as well, just to improve patient satisfaction or start programs that are needed. I get certifications. I strongly believe in certifications. I'm a clinical hypnotherapist. I teach hypnotherapy now to people just starting into that field. I teach stress management, and I provide lots of workshops for local businesses and facilities. Sleep clinics, I work in a sleep clinic. I haven't for the last 10 years or so, and I know there have been changes in sleep clinics and certifications, but at one time I was certified in sleep clinics. Pain clinics as well, pain management and approaches. I have a colleague who's a health psychologist who works for Cancer Clinics of America, and her job is to integrate complementary and alternative therapies for the patients. So if the patient has this issue and has to have the background to understand, an acupuncturist would be appropriate for this patient, a massage therapist would be appropriate for this patient, and a cognitive behavioral psychology. And they bring in those departments or those specialists to help manage the patient. Anger management training is available and getting a certification in that. There's a big demand for that, especially in areas like the court systems or in the prison systems. I have a master's in holistic nursing. I'm an advanced holistic nurse practitioner. So I have, besides hypnosis, there's many other complementary alternative therapies that I'm trained in. I may not do them, but I'm trained in them, so I understand when they're appropriate and when they're not. And of course, behavioral medicine certifications are available. Look for a nationally accredited one. Next slide, please. All three of us right now, Dr. Perry, Dr. Howard, and myself, are working in research, and we help them collect and analyze data. I'm doing it in academia and in hospital settings. I know other people are doing it with drug companies and product companies. One of the products that I'm being encouraged to, and it's kind of exciting because I had to sign this non-disclosure, and I can't say what the company is, but it's a new product that they're developing. It's a big company, and they want a health psychologist with my background in complementary alternative therapies to assist them. And I'm going to be paid very well when that project starts to unroll. Also working in policy, sitting on policies. There are also paid positions for policies in government organizations, but sometimes you have to start with volunteering for government organizations. And being involved with academia opens that door a little bit more to see what organizations might need you, but addressing things like inequities, disparities, and healthcare reform. Next slide. I could tell you a little bit of a story. I got a speeding ticket. Yes, I deserved it. And I was speeding, but I wasn't paying attention like I should have been. And I went to the court date, and I approached the judge, and I said, I'll pay the fine, but I would like you to completely waive this ticket. And here's what I'm going to offer you. I'm going to offer you 4 weeks of stress management classes. And here in Tennessee, judges can sentence someone to training. And so that was like May or June, I got the ticket. In September, I did the 4 weekends of stress management and anger management training. There were 2 police officers there, which helped because these people have anger issues. And so they not only helped me present, but they gave, they added to the richness of the presentation and did anger management presentation. It was so well received that they have written a grant now so that I will be doing that probably twice a year, and it's gonna be a little shorter, but it's kind of fun, and it was a way to get out of having a ticket on my insurance. So heads up on that, that might be an option. But in the words of Dr. Perry, she said, find what you love to do and be the best at it. And I just love to teach. I love to stand in front of a group. I love to see those aha moments go on people's faces. So this is the perfect career for me, and I hope you consider it as well. Next slide.
Well, and I want to thank you and echo some of the sentiments that I see in the chat about your experience in and expertise in the health psychology field. It's truly impressive. I'm overwhelmed.
Oh, I get around.
Your schedule must be very busy.
I am. I'm a very busy person, but I'm also very obsessive compulsive and manage my time very well. So that when you're eclectic and you do all these different kinds of things, you have to book things like your own self-care, because it can get, you'll end up sleeping instead of doing which sometimes in itself could be self-care. But finding a way to make a difference. I'm a big, strong believer in social change, and I'm hoping that students who are listening to this and considering health psychology realize that this is kind of a really cool profession to be in. I do have a background in nursing and it helps in health psychology, but neither Dr. Perry nor Dr. Howard have that nursing background. So it's not really needed. You do have to have a passion for health and an understanding of health. Get back into those old pathophysiology courses in your undergraduate to look at disease processes. And sometimes I have to look stuff up because it's not a disease process that I'm familiar with. So sure. Lots of opportunities. I wonder if there's any questions for me in the chat.
There is. One question is, what would you say is a good way for someone beginning in this field to get started and dig in?
Community service, getting known in your community. Like, for example, at the Rape and Sexual Abuse Center here in Tennessee, where I am, I started doing those how to get through a PAP test for women, and it turned into almost 20 years of income. And it's something I really can step in and do because I've done it for so long. It doesn't require a lot of preparation anymore. I'm comfortable with it. So start with some community service. And, if you keep that social change, positive social change thing in the back of your head, then you're going to make a name for yourself locally. Because I'm old and I've been doing this, I graduated in 2006, but I graduated originally in 1986 and 81. I've had opportunities now for presenting outside of the country and really am internationally known. Another thing that's really important as you're working on this stuff is write it up, publish it. I did a project for Botswana nurses. The nurses, and I go to Africa every couple of years to do some teaching in South Africa and Botswana. And the Botswana nurses were leaving the profession because there was some real shame associated with being a nurse, and it just got some bad press. And they did, they approached me to help them boost the morale of nurses in Botswana. And I got a hold of Johnson & Johnson. They've got those commercials, be a nurse, and got a lot of their material, went over there, got a grant, got every nurse in the country a brass pin that said, "I'm proud to be a nurse." And it had the little Florence Nightingale lantern on it. And every nurse in the country got it. We brought in people from each of the regions and we trained them how to work with nurses and how to work with the public and how to promote nursing. So that was all kind of exciting stuff that was just done because I had done a speech in Botswana at a university on stress and stress management. These things just develop.
That's wonderful. And we have a few more minutes left. If there are other questions, you can please post them in the chat.
Okay. And Dr. Nina Neighbors, it was 635 pages, my dissertation. It was mixed methods. So yeah, you remember that. That was painful.
I remember it. Promise to read it once only.
Any more questions? I am a graduate of Walden University with my PhD, and I have taught here since 2006. Now, everyone just don't start pushing to line up to sign up for health psychology. We can get you all in, okay?
And I don't see any more questions coming in the chat at this time. But I want to give you a heads up about the next session coming up. And once again, thank you for joining this session. And once again, thank you, Dr. Rose Wilson, for sharing your extensive expertise We hope you take advantage of some of the other sessions that are taking place throughout the day today. And then after the conclusion of the event, watch your email so that you can access to the session recordings for any sessions you might miss. And be sure to give us feedback using the event survey. In the chat, I posted the link to the session catalog so you can quickly access that and locate the link to join the next session, which is called Each One Teach One. And it's Dr. Brian Ragsdale talking about lessons learned from Walden and beyond. So we hope you enjoy the remainder of the symposium, and we look forward to seeing you in some other sessions. Thank you all.